Mr. Pearl, how are we doing today?
All right.
Good. I'd like to introduce myself. My name is Josh. I'll be your physical therapist today.
Okay.
Just checking in with you at the hospital. Can I get you to confirm your name, your age, and your birthday?
I'm Mr. Pearl. I'm 67. My birthday's November 25th.
Perfect.
Yeah.
And then just to see, how did you sleep last night? Like, how are we doing?
It was okay. I mean, just a little bit of pain, but slept all right.
Slept all right? When you say okay, like, how many hours did you sleep last night?
6.
6? Okay, so not a quite full 8, but did that feel pretty restful to you?
Yeah, that's what I usually get.
Okay, sounds good. Perfect. Thanks for answering those. Those are just to make sure that I'm treating the right patient and that you're pretty cognizant and aware of what we're going on today. So I just wanted to talk to you a little bit about what I had planned today and kind of how we're going to progress. So yesterday I read in your chart as I came in that you did great with your activities yesterday, moving around the room, got that catheter out, and that you're good to go to the bathroom. So what I want to do today is clear you for, my goals are to clear you for complete room mobility. So we'll practice some transfers to the bed, to your chair, to the bathroom. That will clear you to shave, take a shower, bathe yourself as long as you're seated. They've got a chair there in the shower for you. And then we also want to move on to the next step. So right now we would say you're at about stage 2. We want to move into stage 3, which would be mobility in the hallway. So see how we're doing there. We're aiming for about 5-minute walk. How does that all sound to you? Does that sound all right?
Yeah, I mean, I want to get back to
Home,
get out
right?
of here and
Yeah,
get back.
and that's the next step to getting home. Shouldn't be too much longer. Do you remember them yesterday talking about the RPE, or the rating of perceived exertion?
Yeah.
So it's just a scale 6 to 20, and I'll just ask you several times today while we're doing things, kind of like where you're at this 6 to 20, and I'll carry this with us if you have any questions. 6 meaning you're doing no work, you're laying in bed, 20 being I just finished running a marathon and I'm exhausted, and then we've got some descriptors here kind of for in between. Because of your recent stent that was placed, we don't really want to get much above like 10 or 11, just because we're capped at having your heart rate be 12 beats higher than your resting heart rate. Okay. So we don't want to get it up too high, but we are going to get up to around there. The next one, this is kind of printed kind of small, is called a dyspnea scale. It's a fancy word for out of breath, and it goes 0 to 4, okay? 0 meaning not out of breath at all, 4 being I'm completely out of breath, again, running that marathon. So I'll ask you a couple times. Just right now, how are you feeling on that 0 to 4 scale?
Oh,
a 1. So not really out of breath, but because you're sitting up a little bit. Okay. And then on that RPE scale, I forgot to ask this. Where are you at right now, just sitting in your chair?
Between a 7 and 8.
Okay, so still pretty low, nothing to worry about there. Okay. And then the last thing that I want to show you here is the pain scale from 0 to 10. Just, we've got smiley faces here, 0 being no pain, 10 being the worst pain you've ever had. And then and I'll ask you about this as well throughout our visit, but where are you at right now?
Just like overall?
Yeah.
Like a 5.
A 5, okay. Sounds good. If you're comfortable with it, is it all right with you if I take your vital signs real quick before we start working?
Yeah.
Okay.
I was gonna ask you,
Yeah.
Can I take 5-hour energy, just kind of like with the heart medications they're giving me?
Yeah, so they've got you on a beta blocker after that surgery. So to kind of explain what that beta blocker does is it's to decrease the load that's on your heart. They just put that stent in there. So is it just like you feel tired or you get dizzy when you transfer or change?
Yeah, I was just wondering if it'd give me like some more energy.
Some more energy.
Doing stuff.
Unfortunately, those are really high in caffeine, right? Your 5-hour energy. So what that's going to do is that's going to increase your blood pressure, which we really don't want to do right now. And we also want to keep that load on your heart pretty low. So I would highly advise against it. I do think though that getting you up, moving around the hospital a bit is going to help you to feel a little more energized, just because we're going to be moving around, we're going to get that blood pumping. But let's talk about some things that we can do to increase that energy without taking anything that's going to put extra load on your heart. How does that sound?
Yeah, that's okay.
Is that all right? Okay.
I mean,
So-
those commercials are just so.
I know, right?
so
Like
well
get up and
done.
going.
I want to take it.
So because you have the IV there in your left arm, we're just going to go ahead and take this on your right.
Okay.
Okay. You're probably sick of us doing this.
It's okay.
Not too bad. If I can find your break. You can rest your hand kind of there. Well, it looks like those beta blockers are doing their job. Your heart or your blood pressure there is at 118 over 78, so nothing to be concerned about there. I'm just gonna write that down real quick. Okay, and then I'm gonna go ahead and take your heart rate as well. So Alright, got a nice low heart rate of 60 beats per minute there. Then you can just bring your hand over your chest there. Your respiration rate seems pretty good. Are you having any pain in your chest or any similar to what you've come in for?
No, it hasn't been too bad the past few days.
Perfect, that's what we're looking for. I'm gonna check real quick just your oxygen levels. So it's just gonna go on there. So yeah, we don't want any chest pain like what you were coming in for. If you have any chest pain, please make me aware as we're exercising. I don't anticipate it happening, but let's look at that real quick. Awesome oxygen saturation. So I don't see any concern with getting up, moving around. But I did want to ask you about a couple things that I saw on your chart yesterday. Having any pain in your lower legs or anything like that?
No.
Okay, do you mind if I check the temperature of your legs here?
Yeah, that's okay.
Okay. And then if I give your calves a squeeze here, is there any pain?
No.
Perfect. That's just ruling out what we call a deep vein thrombosis, something that can be a side effect of the surgery that happened. But you don't have any redness or swelling, pain, or the temperature is normal, so I'm not seeing that as any kind of concern. And then I'm gonna check your toes here. Can you wiggle your toes a little bit for me? Perfect. And then I'm gonna pop your sock off here for 1 second, just to make sure that we're refilling here. Feet are a little bit cold, but I think that's just because you're in the hospital.
Mm-hmm.
Let's throw that back on for you. And then I'm gonna check this side. What that is we're just checking your capillary refill just to see how the blood is circulating towards your feet. So in your chart, I saw that you have dizziness when you stand up. Have they talked to you at all about belly breathing or changing the way that you breathe?
I think they did mention that yesterday.
Okay. So while I was taking your respiration rates, I noticed that you were kind of breathing with your upper chest there. So real quick, what I want to do is whenever you start to get dizzy, I want you to place a hand on your belly and kind of push that hand out as you take a breath in. You'll take a breath in through your nose and then kind of out through your lips. And if you want to make noise, you're more than welcome to do that. But we're just going to do that to help fight off that dizziness, okay? The other thing that we're going to do to fight off dizziness is when we transfer, when we go to standing, that beta blocker medication that you take kind of makes our bodies slow to adjust to pressure changes. So we're going to pump our ankles, kind of lift ourselves up or lift our toes towards our nose, or walk in place. And that should help circulate the blood and kind of level that blood pressure, help fight off that dizziness.
Okay.
Okay? Do you have any questions for me?
So we're just gonna be walking today?
Yeah, we're gonna work on a couple transfers here in the room, but then we're gonna go for a walk out in the hallway.
Oh yeah, you said that.
Okay. Family, do you have any questions for me? No?
Oh, my son, he's a little
so
shy, sorry.
Oh, no worries. Okay. I'm gonna put a gait belt on you first. This is just in case if you're comfortable with that.
Yeah, that's all good.
Okay. Can you go ahead and lean forward just a little bit for me?
So just hand up.
How's that feel for you?
Good.
Feels all right? Okay. So, I want to get you cleared to just be able to ambulate in your room without a physical therapist or a nurse here. So the first thing that I want to do is I want to work on moving from chair to bed to the bathroom. Moving from the chair and the bathroom should be pretty similar because they have those handrails. So we'll just do a couple of these transfers here first, okay? Yesterday on your walk, did you use a walker or were you doing it on your own?
We used the walker.
You used a walker? Okay. Let's do in the room. We're just gonna, since I'll be right here next to you and we're not moving very far, we'll do it without a walker, but then when we go out in the hall, we'll use a walker as well, okay? So, do you remember nose over toes? So I want you to be able to push off with your hands, yep, arms on the edge of the chair. Kind of tuck those feet just back there like you have. And I'm gonna come up here and give you as much help as you need or as little help as you need. And we're just gonna go nose over toes and then we're gonna go transfer over to the bed, okay?
Okay.
And 3, 2, 1. Fantastic. Any dizziness there?
A little bit, yeah.
Okay, let's focus on those belly breaths and that pumping of the ankles. Does that help fight it off at all?
Just a sec. Yeah,
Okay.
it's get better.
Then let's take a couple steps this way and practice turning. I'll manage your IV pull here. And sitting down, reaching back behind you, perfect. And then do you remember how to transfer into the bed? Did they work on a process of this with you?
Yeah, but we probably have to do it again.
Okay. So what I want you to do here, let's actually stand up and move a little bit, because right now if we lay down, we're gonna overshoot your pillow. Perfect. And then let's get ourselves back on that bed as far as we can.
Okay.
Great. So then in one motion, what I kind of want you to do is I want you to lay down, and I'll help manage your legs if you need it, but
Okay.
we're gonna put this shoulder, we're gonna bear weight through this arm, we're gonna lay down on our side, okay?
Okay.
Ready, and go. Great. And then we're just gonna roll over onto our back. And that's gonna be the process of getting in and out of bed, okay?
Okay.
So let's go ahead and transfer out of bed, and then we'll get ready to go on our walk.
Okay.
Okay, so same thing. I want you to bring this right knee up. You're gonna push with that leg to roll yourself over, and then we're gonna sit up. We're gonna kind of do this all in one go, okay? Just like you would. So these legs are gonna swing off the end of the table after we get rolled up onto your side. So go ahead and roll up onto that side. Perfect. And then you're gonna push with this arm, and we're gonna swing these legs off. Fantastic. How did that feel to you? Pretty comfortable?
Yeah, I'm a little dizzy.
A little dizzy, so let's pump those ankles. Let me lower the table here for you so that you're reaching the ground. Pump those ankles, use that belly breathing technique. How are we feeling?
Yeah, just give me a minute.
Okay.
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 All right.
Okay, now we're gonna go ahead and get ready to go out on a walk if you're feeling up to it.
Yeah.
Next step, okay? So again, nose over toes, pushing off the base, and then I'll have this walker here for you. And ready? 3, 2, 1. Dizziness kicking in again.
A little bit.
Okay, pump those toes. Belly breathe.
All right.
Okay. So I'm gonna go ahead and grab this walker. Have you ever used a walker before?
Mm-hmm.
Okay. So I think you're pretty stable. According to the notes from yesterday, you did pretty well with your exercise. So this is here for stability. I'm gonna be walking right behind you. I'll manage your ID pole here. But we're gonna go take a walk out in the hallway. We're gonna try to walk for about 5 minutes. Halfway through, I'm gonna take your blood pressure again, just to see how we're doing. But does everything sound good to you?
Yeah, that's okay.
Okay, I'm gonna come right behind you. And let's go ahead and go out into the hallway. Mr. Pearl, how are you feeling?
Okay.
On that dyspnea scale, what are we at?
Oh, between a 1 and 2.
Okay, not too bad. Has the pain increased, decreased, about the same?
Pain's about the same too.
Okay. So as we're prepping to get you out of this hospital, can you tell me a little bit about the living situation at home? Like, you have stairs, is somebody living with you?
Yes, I live with my wife.
Okay.
There's like 2 steps to get into the house.
Okay.
But our bedroom is on the main level.
Okay.
We have a downstairs. I don't want you to go down there for a while.
Okay. How are we feeling right now? Very tired, anything like that?
Oh, a little tired, but I'm okay.
Okay. As far as, because you're 67, how capable is your wife of helping you around the house and things like that?
Oh, yeah, very capable.
She's really good.
Yep.
Awesome. Okay. We'll walk over here. We've got a chair right over here that we can have in case we need it. I want to see you do as much. We'll just walk right over into here. And you go first. I'll follow right behind you. Okay. I don't think we're going to need this chair. I'm going to take your blood pressure real quick if you're all right with that. How are you doing stability-wise standing here?
Oh, I'm okay.
Okay. This is just to let me know kind of how you're reacting to the exercise.
Oh wow, I'm looking on my computer. No, yes, not Delta. Yeah. Well, yeah, that's crazy.
Okay, well, at least you can see the bins. And I think that honestly, this is what I was talking about with the convex.
Yes.
I think it's just talking about that, literally the interior like arch.
Awesome. It seems like those ankle pumps and exercise didn't raise your blood pressure overall. Maybe it did when we first stood up, but nothing that's concerning me as far as exercise goes. Let's go ahead and make our way back to the hospital room, and we'll talk about what our plan can be for tomorrow and kind of how we want to progress. Does that sound all right to you?
Yep.
Okay. I'll let you go first. How would you say you're on the rate of perceived exertion? How are you feeling? That's the 6 to 20. You told me while we were sitting in the chair, you were about 7.
Yeah, now it's like 9 or 10.
9 or 10? Okay. That's about as high as we want to get with that stent in place right now because of the recovery time. But we're at 9 or 10, that's all right. When we get back to the Hospital, I'll take your heart rate. Hospital room, I'll take your heart rate just to make sure that we're within those limits.
Okay, you feeling all right?
My buddy Joe over there.
Yeah, you guys had the same surgery.
Yeah.
Perfect, and we'll just park the walker right there. And do you want to go in bed or in the chair right now?
In the chair.
In the chair? Okay. You're gonna need to turn kind of to your left if we're gonna do there. Perfect. And then let's back up till we're at the chair there. So your legs are touching. And then let's see how you do that transfer. So if this goes well, I'm gonna clear you for in-room mobility without me here. You did awesome. Got all sorts of stuff going around my neck here. So real quick before your heart rate comes down, I want to take your heart rate to make sure that we are within that normal bounds. Perfect. Bumped up a couple beats per minute, but we're not pushing it. We're still within that 12 beats of your resting. Okay. Want to talk to you. I'm feeling pretty good about clearing you for in-room mobility on your own. If you're feeling stable, just make sure to use that walker as you're going to and from the bathroom. Like we said, showering or bathing yourself shouldn't be a problem as long as you're seated. That's not going to be too hard. And then, how did you feel about that hallway hallway walk? You feel all right?
A little tiring, but
A little tired.
yeah, I think once I keep going, it'll be good.
Okay, so one thing that we want to work up to is 3 to 4 walks a day. Right now, I'd say use the walker still and make sure that somebody's with you. But you did really well on that walk. It might be a little bit tiring. I don't want you to overexert yourself. I want you to stay probably at that 8 RPE scale that we talked about. But do you have any questions about how the visit went for me today?
No? I think
Okay.
that's good.
Next time, what we're gonna do is we're gonna try to up that walk time. We're gonna try to get you even closer to going home. I don't think it'll be too much longer though before you're headed home.
Okay.
Okay.
Sounds good.
Hey, thanks, Mr. Pearl.
Thank you.
Let me grab that gate belt. I don't think you want to wear that all
Oh,
day.
that's right.
But. Okay. Well, have a good afternoon, and I'll see you later on.
Okay, see ya.
See you.